thanks very much to the organisers for inviting us to speak in this session. I'm going to briefly introduce our HR project, which is investigating individual and environmental approaches to promoting alternatives to the car. And I'm speaking on behalf of a wider research team. These are people from the University of Cambridge, Fuse, London School of Hygiene, Tropical Medicine and Bristol. And you can see their names and mugshots on the slide here. The project's idea was kind of formally conceived back in 2016, and at the time there was considerable attention to the car. And so you can see from this article in The Guardian around a car-free school planned entirely for Leeds. But it was also particularly true in new towns. So the Healthy New Towns was a name given to areas that were awarded funding to improve conditions for walking and cycling in existing areas, or by creating whole new towns. And whilst the scientific literature described benefits of walking, cycling, little was known about which interventions might be the most effective or could be effective. So our research focused on these two new healthy new towns. We did also explore wider issues nationally. So our project started in October 2019 with the first work planned for April last year, a key time now in many people's minds. In the intervening time, COVID has placed greater emphasis on walking and cycling. And this was accompanied by substantial funding from government to make changes to local environments to encourage social distancing, walking and cycling. So our findings may actually be even more relevant than we first envisaged. So onto our 3 work packages, and what exactly did we plan to do? Well, these work packages were differentially affected by COVID. The first was a feasibility RCT, and because travel to work was restricted during COVID, and this was a key study outcome for us. The study's been paused, but we hope later in the year. The second was a package of ethnographic work, understanding children's experiences of the journey to school. And again, with many children not commuting to school, this work has been paused, but Steph will talk about the work she's been doing in the intervening period, looking at children's experiences. And the third work package aims to understand the policy process for embedding health into policy and the policy context, but with such a focus on active travel. We've really focused our work in this work package on active travel. And as I say, both Steph and Emma will talk about these shortly. So in order to make things active, we'll be using some polls. So to start off with, we'd like to get a sense of our audience. I think Sarah might be able to help us with our first poll. So I think if you just go to the polls tab, you'll be able to participate in the poll. So people from research and in academia in the audience, some from practice and some from both research and practice. So that's really good to know. So next I'm going to pass over to Steph, who will be talking about some of the work she's been doing, this project. Steph, I wonder if you can share your screen. You're muted, Steph, I think.
Okay, hi. I hope that you can all see my slides now. So today I'm going to be sharing some preliminary results from a qualitative synthesis that we've been doing on children's experiences of their journeys between home and school. So, as I'm sure you know, active travel has many benefits to human health and environments. But in England, the proportion of school journeys walked or cycled has decreased by nearly 20% since the 1970s. and 46% of school journeys are now walked or cycled to school. So just to get some interaction, I'm wondering how the people in this room compare to those sort of national statistics. So if we can just have some help with this poll on if on the poll side, you should now see one that says, if you or a family member or friend have children of school age, how do they usually travel to or from school? That one should now be visible.
Katie, I don't think we've got that one on the poll. I think we've got another one, another question that's popped up on the poll.
There are two polls there now. I've just shared the if you or a friend or family member have children of school age.
That would be great. Yeah, if anyone could answer that, that would be really great. And just seeing now that we've got some votes coming in. So we've got a few people that have car, cycling, walking, and quite a lot of people that don't have any children or don't know any, including myself. So that's great. In comparison, the government is looking for aims to have 55% of children travelling actively to school by 2025. So I guess we're sort of well on our way there in this room. So there are efforts to increase active school travel, but these have been shown generally to have quite trivial to small positive effect sizes, with multi-level interventions tending to be most effective. So to learn more about what might make active travel to school more successful, it's useful to start with people's experiences of their journeys. So much of the qualitative literature to date has focused on parents' attitudes and views, often on barriers and facilitators to active school travel. And parents whose children do travel actively often recall positive benefits from active travel, but these tend to be quite future orientated. And now several authors have been calling for a couple of decades for more child-centred approaches to studying perceptions of active school travel and allowing children's voices to really be heard here. As children can add important and novel insights for learning about active school travel, especially their experiences of the present. So, bearing this background in mind, this study aimed to explore how children experience their journeys between home and school. And to do this, we had two objectives. The first was to synthesize existing qualitative research on children's experiences of their journeys to or from school. And the second was to assess how children's experiences of the journey were understood and highlight any approaches that would aid further understandings. And it's important to mention here that this qualitative synthesis was conducted to inform our ethnographic study on children's school travel experiences in 2 healthy new towns in the UK, which was delayed due to COVID-19. But if we secure its costed extension, we're going to aim to begin this work from September. So that would be really exciting. So this was our methods. We had 3 stages: a systematic literature search, quality appraisal, and then the meta-ethnography synthesis itself. So first, our systematic searches and study selection. Here you can see the selection criteria we used. We focused on children aged 5 to 13 because at this age they're gradually gaining independence from their parents over a number of years, and we excluded mixed method studies where the primary study reported was not qualitative. This was because we're looking for conceptually rich papers for this review, and we excluded grey literature for the same reason. We only included papers that investigated the school journey specifically because of the vast amount of literature on children's mobility more broadly, which would make a review of this kind unmanageable. So here is our study selection process. We searched 5 databases, screened 5,213 records and 120 full texts, and we ended up including 21 papers which reported 18 different studies. So for our quality appraisal, we followed a method of other high-quality meta-ethnographies in health research. We used the CASP tool to assess methodological rigour and relevance to our research question. And through this process, we categorised 12 papers as key, 9 as satisfactory, and none were excluded as fatally flawed. So here are our included studies. You can see that most are from high-income English-speaking countries. Half included parents as well as children. And they had a range of methods, but most relied on recall of experience. Only 4 used real-time methods such as participant observation and ethnography. And so for this synthesis, we decided to use meta-ethnography because it's interpretive, not aggregative. It was suited to our question about experience, and it also fits my methodological training as an ethnographer and an anthropologist. So meta-ethnography is about synthesizing how studies are related to each other, incorporating context. It is a process of developing interpretations and conceptual insights by providing an analysis of what a set of studies can say about a phenomena as a whole. So the process first was that we read and reread the papers. Then we identified 141 second-order constructs. And these constructs are the author's interpretations of children's experiences of their journeys. And these are basically the themes within the studies. And these themes act as the data to be synthesized. Next, we translated these themes through the interpretive process of comparing constructs across studies and formed them into 13 higher order themes, or what we call third order constructs in meta-ethnography. And then finally, we chose a line of argument synthesis because this form of synthesis recognizes that authors will study different aspects of a phenomena and that it might be possible to offer a fuller account of that phenomena by arranging the study's themes in some order that allows us to construct an argument about what that set of studies says. So here are our third order constructs that we developed, and this is how they contribute to our line of argument that I'm now going to talk through. So in contrast to the safe spaces of home, we found that a sense of vulnerability featured prominently in children's experiences on their journeys to school. This emanated in different ways, feeling fearful and frustrated with traffic, such as around school drop-off zones, feeling at risk within the material environment, such as concerns about injury on footpaths, and feeling vulnerable to other humans and non-human animals, such as dangerous dogs, bullies, or other bad people, as children called them. Now, some studies explicitly discussed how children perceive themselves as less mature and smaller than adolescents and adults, and that this could result in them being less capable in judging dangerous situations or being deceived, or even less visible to drivers who children often said did not see them or drove like crazy. And children's sense of vulnerability was connected to past experiences of their own or others, societal concepts of risks, as well as parental anxieties. And these feelings of vulnerability altered across seasons and contexts. So children living in areas of deprivation often experienced more violence, and in contexts of cold winters, children were very wary of ice on pavements, posing greater risk of injuries. So although some papers found that children reported not being allowed to travel by certain active modes due to perceived dangers from traffic or strangers, many studies discuss how children innovatively negotiated and managed risks. Studies analysed how children learnt to assess roads and traffic and map out the safest routes to school, including enacting complicated rhythms of waiting, moving, observing and monitoring at zebra crossings, for instance, and how children avoided areas where they knew risks from bullies or bad people were likely to happen. And studies also talked about how children negotiated with their parents to travel actively or to be chauffeured in some cases, and how children also moved together for safety, engaging in this gradual process of creating competence through care and supervision with parents, siblings, and friends. And Coleman, one of the authors, highlighted that instead of shying away from their fragile entanglements with material environments, children and parents established these collectives of care as part of a continual learning process, which enabled children to gradually gain a sense of agency in their local environments. So children across most studies enjoyed social interactions with others on their journeys to school. There were differences between those using passive or active modes, with chauffeured children experiencing more interactions with parents and siblings, and children travelling by bus, foot or bicycle engaging more with human and non-human animals outside of the nuclear family unit. And sociality tended to include talking and playing games with parents or friends, depending on travel mode, But active travellers also experience light touch sociality with other familiar friendly faces in the local area and friendly animals such as cats and dogs. And some argued that children who walked shared the same trajectories, rhythms and tempos, which can create new, affective and sensory bonds and add a sense of togetherness amongst co-travellers. So we found that many studies showed the importance of how children, particularly those who used active modes, enjoyed engaging with and exploring on their journeys to school. Our studies described active travellers taking diversions or shortcuts, often to move through enjoyable green spaces. Children found innovative ways of enacting agency on their journeys by engaging in careful risk-taking, playing with and exploring their routes and defining their own adventures, which circumvented adult control and imposed orderliness. Children travelling actively also engaged with natural forms, noticing intricacies such as changing colours of trees and leaves, mentioning birds and insects, and interacting with natural elements, such as creating spontaneous experiences in the pouring rain or snowfall. And now, in contrast, some authors described how those who were chauffeured were aware of missing out on such things and could see things through windows instead, and they were much less likely to report spontaneous occurrences on their routes to school. And lastly, studies tended to describe embodied experiences more prominently in active travellers. So we found several studies showing children enjoying physical activity on their journeys to or from school, with some discussing feeling energised from being in the fresh air. Children also experienced varying weathers, with some finding extremes of weathers as off-putting, but others claiming they were happy walking in the rain. Now, different terrains produce different experiences, with some expressing different comforts, climbing hills and carrying heavy backpacks. And speed and distance were important aspects of journeys, with many enjoying quick or short journeys, regardless of mode, which ties with proximity to school being a predictor to active travel. However, authors also showed children wishing their walks to school were longer so that they could engage in more physical activity. And some studies found that walking was a time for reflection and contemplation and imagination for some children, and that this was particularly so for those who chose to walk alone. So as we end at school, we can see that this journey between home and school offers children a process of learning and a means of developing agency within their local environments. Now, to visualise this for you, the vulnerabilities that children feel can be transformed as they develop skills in risk management and forms of collectives of care. When risk landscapes are well managed, children can experience what we could consider co-benefits, engagement with others, exploration of their environments, and some embodied experiences of physical activity, contemplation, and reflection. And in this sense, those vulnerabilities experience can, through engaging actively with their journeys, be transformed into a sense of agency, which is essential for developing autonomy and independence as they grow up. And it's important to say that studies did report some children enjoying the sociality and perceived safety of the car, but the co-benefits afforded by active modes were really quite limited for chauffeured children. So some preliminary conclusions to this preliminary analysis. We suggest that children who do feel vulnerable in their local environments can manage these feelings by managing risks in collaboration with others. And although health and fitness was discussed in studies, it can be analysed as a response to dominant health discourses, and health was just not a huge part of the experience for children. So efforts to make environments safer for children are obviously key, but instead of health and environmental messaging, the active commute could be promoted to parents possibly as a means of learning about the local environment, and actually almost as another part of the school day. And maybe for children, it could be promoted as a means to socialise, explore and play. So if children do feel able to make decisions and navigate local environments on their routes to school, they are probably more likely to be able to be mobile and use active modes of travel elsewhere in the present, but also in the future. So thank you very much for listening, and please feel free to ask any questions, and I will just stop sharing that screen. Thank you very much.
Do we have
So
any?
anybody?
Oh, sorry, Steph. I was going to say, do we have any questions?
So anybody can ask questions in the chat at any point. Or we can also ask some questions to you.
So Matt's put in a question that's asked, will we be applying findings from this project to the currently paused parts of the project when they... That's a good question, Matt. I think we'll be drawing on the learnings from Steph's review and Emma's work that she's going to be talking about, hopefully when we start some of the... Yes, definitely. Steph, do you want to elaborate?
Yeah, I was just going to say, Matt, thank you for your question. Yes, so one of the findings from this review is that a lot of the studies that we've synthesized here are not ethnographic. So there's sort of 3 or 4 that use like participant observation and methods that involve being there. So our methodology will be contributing to that very small body of literature. We're going to be using mobile ethnography, so that would be go-along interviews, so walking or moving to school with children and spending time at the school gates. So the methodology will really be contributing to that. So that's one of the things that I think has come out of the synthesis work, that we know there's a bit of a gap there that we're going to aim to fill. Just looking for other questions here. Carolyn's asked, did I do the drawings myself? I don't know if that was directly to me or to the group, but yes, and they were, I can pretend that they were deliberately childlike. And Jean here has asked, how much do you think children's concerns about ICE bad people reflect their concerns of their parents' concerns? Is this even distinguishable? Yeah, so some of the papers in this review did talk about that, Jean, and how these feelings of vulnerability are largely socially constructed by and through others surrounding children, which I don't think they can necessarily be distinguished in that, everybody's experience are bound with others and constructs of risk in society. You're kind of inescapable from it. And as a child, you are positioned as vulnerable, and generally even school is actually historically been positioned as a space to kind of keep you safe from the kind of evils of the world. So I think that, yeah, that's all very much entangled in those feelings that children have about their concerns on their journeys to school. Yeah. Thank you very much for those questions. I wonder if now is a good time to move on to Emma's, or if Jenna, if we should ask some questions on the chat as well.
I think some questions on the chat from the presentation might be good to promote.
Yeah, I guess I can just say them rather than typing, because that might be a bit tricky. So one thing we were wondering from this is if you might have any ideas about how do you think these findings could be useful for promoting active travel, and actually do you think that understanding children's experiences is helpful for interventions that we are doing? If anybody has any thoughts on that, in what ways these experiences can be used.
We do have plenty of time for questions, so it is okay for people to be typing questions or thinking, and my is a bit different.
Yeah, so I've got some comments from Matt there about if the main appeals of active travel to children are not health. This is an example of how a health intervention could be promoted by emphasizing issues less directly about health. Yeah, and those examples there, and I think I would definitely agree with that. And I think one of the interesting things is that some children who, in a couple of papers, who did negotiate to kind of travel actively with their parents, they did use the health. Authors said that they used the kind of health promotion messages to kind of persuade their parents to allow them to travel, because they know that that's important to parents, but not so much for them. So that's kind of interesting that they're actually using their agency to kind of persuade their parents, you know, cleverly using health promotion messages. I think that's quite interesting, but for them it's much more about sociability and exploring. So that's really interesting. We've got some other comments here saying, Jenny saying that showing children might want to spend longer walking than parents may think. Yeah, I think it's just generally children were saying that they just wanted to be active for longer, and if they enjoyed it, they really liked it. So if you had just a 5-minute walk, that wasn't really enough. So I think duration and distance maybe went together there. Got some other people here saying, I think the findings can lend justification to intervention development, as it can ensure interventions designed that are fit for purpose. Yeah, absolutely. Because if we're going to be designing these interventions for children, it's really important that there's some justification in there from children themselves. I think that's quite, yeah, thank you, Sarah, that's really useful insights. We've also got Jenny here talking about emphasising many other benefits to children and parents, like development and transferable skills could be really useful. Yeah, because if this is a learning process, then I think that's those things are really going to help people with developing their interventions, and that's really great to have those insights. Thank you, Jenny. We've also got Bethan asking, how do you make active travel inclusive and accessible for all? That's a really good question, Bethan, and I think a lot of well, the kind of work on infrastructure that Emma's going to be talking about might sort of help with that, because I know that there's lots of you know, inclusivity in terms of infrastructure design for all kinds of people with various needs, and I think that's really important, especially when you're building new developments like the Healthy New Towns that we're looking at, like pavements, structures, spaces for wheelchair users, prams, all kinds of things. And I guess the thing about that is that you know, with accessibility, one thing that might work for some might not work for others, but some things that say work for wheelchair users also work for pushchair users and elderly people, so they're actually catching many more people than they maybe are initially just designed for. So I think Emma might touch on some of that too. Did any new and maybe surprising themes emerge from this, from the work? I feel like I've been so immersed in this literature for so long now, I actually can't remember what I initially thought would come up before we did this. So I wonder if that might be something that, Jenna, was there anything that kind of surprises you in this work? Because I feel like I'm a bit too immersed in it to be able to say what I thought was going to come up before.
I guess maybe we wouldn't have expected, or we might not have thought that active travel as an opportunity for learning and development might not have come across as strongly as it did actually. I think that was something that maybe we hadn't anticipated. But like you say, it's difficult because obviously we know the field and we know the literature quite well, and you've been immersed in this for a considerable amount of time now. So obviously that's one of the benefits of the kind of meta-ethnography approach, because Steph's been able to look quite deeply at these qualitative studies, which have been really very rich. So that's really enabled us to get quite a nice, deep and rich understanding of children's experiences. So that's been really nice. Okay. Well, if you have any further questions for Steph, you can. Oh yeah, Jenny's popped one into the chat. Roger Mackett's written a lot about that. That's
yeah.
Right. So yeah, we've come across some of those, Jenny.
Cool. Thank you very much for those questions. And I think we'll move on to Emma now. I'll mute myself.
Can you see that okay? Is that all right?
The whole PowerPoint software rather than just the presentation. So I think you can go, it's read view at the bottom. It's like a book you can use.
Yeah, that okay now?
Perfect.
Is that okay stuff? Yeah, it's okay. So just to begin with, thank you very much for having me. My name is Emma, and I'm going to be presenting some preliminary results of a systematic review in qualitative synthesis that we have been conducting. So just to begin with, there are some polls yet again. So if you're able to answer, there's 2 questions on the right-hand side.
Could you just clarify which polls you want? Because there's a few in here.
I had asked once about how much people engage in active travel as well, and there was one about the quality of the infrastructure in the area.
Okay.
So either one first. So with the first one there, about the quality of infrastructure, so most people think good, some people think poor as well. And it's a bit of a split. And 4 people very good. Nobody very poor, at least anyway. Yeah, it's a bit of a spread anyway.
You like the other one, which is
I was going to say
any form of active travel.
Yeah, it'd be perfect.
Yeah.
Oh, it's now increased to over half of people think it's poor in their area, the quality. And then the next question is about your own engagement in active travel, so walking or cycling for transport in the past week, if you've done any walking, cycling, or both, or none. So far, a majority walking, almost 3/4. Yeah, so most people watching are engaged in active travel themselves. Yeah, so that was, thank you very much for that. That was great to find out generally how many people actually are engaging in active travel themselves. So just moving on now to what actually is active travel. So active travel is walking or cycling for the purpose of making everyday journeys instead of using motorised transport. There's some evidence it can improve physical activity levels, health, is low cost and doesn't require many skills and can be easily incorporated into daily life. And also it can be beneficial for the environment. So changing the physical environment, there's some evidence it can encourage active travel, for example, introducing bicycle lanes and improving the walkability of an area. Stakeholders often have responsibility for implementing these changes. However, it is often challenging and there's many uncertainties exist in how to successfully navigate the processes. These stakeholders, they have real-world knowledge and practical experience. However, no previous review has synthesized and brought all of these experiences together. Therefore, the aim of this review was to explore stakeholders' views and experiences of developing guidance for, designing, commissioning and implementing changes to the external physical environment, which have the potential to promote active travel. So how did we do this? So we searched 7 different databases using keyword and subject headings relating to physical environment and active travel infrastructure, policymakers and stakeholders, and qualitative research. So we used thematic synthesis to analyse it, focusing on the solutions that were provided in the data in the articles and NVivo software. And we conducted the CASP assessment for risk of bias, and we will be doing the grade CERT-Qual in the near future as well to see the strength of the findings. So the inclusion criteria for the studies. So we were interested in a very broad range of participants, as long as they had some direct experience at some point in the process of implementing changes to the environment. So ranging from town planners to civil service to politicians. The intervention as well, it was any change in the physical or built environment that influenced walking and cycling, regardless if it had the aim of improving health, and it could be of any scale, and also we included any active travel policies. So we were interested in the qualitative data, so stakeholders' first-hand experiences. So we included the likes of interviews and focus groups, any sort of ethnographic data as well. And we didn't apply any sort of restrictions to country or context or language as well. So after doing these database searches, we arrived with over 27,000 articles that we then, after removing duplicates, there was over 21,000 that we titled abstract screened. And then after applying our inclusion criteria and doing full text searches, we were then left with 37 that we included in our synthesis. So just some basic study characteristics of them. So the majority of them actually focused on both walking and cycling, and only 3 of them were on walking. And the majority of them were more kind of general experiences or more sort of citywide, rather than focusing on individual projects or pieces of infrastructure. All of them used individual interviews, and then there was some supplementary methods such as focus groups and workshops and open-ended questions as well. And the majority of them were in North America. So after doing our analysis, we had 4 main themes. So the first one was successfully initiating and maintaining collaboration, securing and maintaining resources, recognizing and acting on opportunities, and navigating the policy and political environment. And I have these cogs at the side rotating because all of them are very interlinked and go hand in hand, and they're reliant on each other as well and have an awful lot of overlap. So they're important to address all of them at the same time. So to begin with theme 1, so this was about identifying the right people and building the networks. So who were these right people? So it was a range of disciplines from multiple levels of the decision-making process, and I provided some examples there. However, the political leaders were most commonly seen to be effective in influencing change. And there was also support for having diverse expertise and backgrounds, and also having this power in numbers, which brought legitimacy to the cause as well. So why them? So the general characteristics of these people were that they had capacity in the role to address this, power to influence and also bring about resources, and had knowledge of the area, or else sought out some local contextual knowledge as well. They were also willing to risk opposition and have difficult conversations, especially with those who had opposing views with them as well. Had personal interest, and quite often they also engaged in active travel themselves, and also had an enthusiasm for the projects. So how did these people communicate together effectively? So it depended on who it was and who the target audience was. So there was multiple different ways that was highlighted in the literature, so I'm only just going to provide a few examples of this. The communities who are wanting to highlight issues, they could use political channels. So this is the likes of letters or petitions, being involved in public advisory committees, and also trying to foster strong relationships with representatives in the areas. Involving the community early in the process and throughout. So stakeholders could do this in multiple ways, with the likes of consultations at the beginning, and also continually trying to get feedback on designs. So this was trying to be less tokenistic, and also as well letting them highlight the barriers and getting input into the solutions, and also meant as well they tended to be happier with the outcome. Stakeholders, they should try and attend some of the local events, some of the amenities such as libraries as well. Media could be used to engage stakeholders and the community by keeping people up to date with what was happening and drawing attention to the infrastructure and what was going on. And also as well, doing some engaging activities, such the likes of even litter picks, just to try and keep momentum, especially whenever there was such a long time frame in the process. Also, there was a need for respectful communication. So people have to be aware that maybe even though someone is trying their best, they may be trying to work against others who aren't as supportive of active travel infrastructure. So any sort of excessive frustration or complaints or aggression could actually be counterproductive. And using appropriate language and terminology for both stakeholders and the community that everybody could understand. So what actually makes a persuasive argument for active travel? So one of the main things that came through was that different people have different expectations of the evidence and what they actually use in decision making. As this article here highlights, they found that public health people, they tended to use RCTs and evidence synthesis, whereas they felt that transport professionals, they looked more at what being done before, other contexts, and worked on precedents as well. There was also the limitations of some evidence also highlighted. For example, trying to be able to demonstrate the benefits of active travel infrastructure. So there was this call as well, maybe that researchers have to be more confident in conveying best available evidence rather than delaying any sort of action. So the sort of rationales that were used were public support. So by showing that the public in the local area wanted it, it was hard for people to argue that they don't. So using personal narratives to try and really make it relatable, and also highlighting issues in the community as well had traction. The economic rationale was often seen to be very persuasive as well. So using arguments such as it being attracting business and tourism and increasing house prices was especially appealing for developers. However, this was slightly more nuanced as well because communities sometimes were wary of gentrification. Trying to make clear links to health, it seemed to be very difficult to argue against health. However, as I said, it's quite difficult maybe to have some demonstrable evidence of how active travel infrastructure would benefit the health of the area. And the decision makers quite often like more tangible, immediate outcomes. And this included the likes of air pollution and traffic congestion as well. However, it was felt maybe to be a hard sell to some groups, especially maybe more in deprived areas where the economic issues they were more important to them, and also as well, it could more be a misunderstood concept. So securing and maintaining the resources to implement these changes. So funding was obviously a big thing. So what came across was collaboration really was the main thing in getting and leveraging funding. So this with other organisations, enable people to maybe access new resources or funding pots they hadn't before. They could pull resources together and expertise. They could apply to lots of different places to bring together enough money to fund a piece of infrastructure as well. And also as well, working together, it gave a bit more political clout and legitimacy to their cause as well. And also the study highlighted about having the community involvement in it, as it actually lent credence and showed that it was a big issue for the people. So the people involved as well, there is about upskilling and educating the people as well. So the likes of training and conferences, also building the resilience. So if there was any opposition, this could be handled more smoothly. Including in the future courses of engineers and planners about active travel infrastructure, so that they were able to make changes in the future and it wasn't as new a concept. There was more mixed views on external consultants, Possibly some people felt that they maybe didn't have the contextual knowledge and they were expensive, whereas others thought an external vision was good and could have new expertise. And also as well, within an area, there may be many advocacy groups, maybe ones that are more for leisure walking or cycling, but they all would really want to have nicer infrastructure to actually use, so bringing them together as well to bring power in numbers. So there was also this need about recognising and acting on opportunities. So some examples that provided were the likes of clean air campaigns and policies, and the oil crisis as well, and accidents, especially with the likes of cyclists were mentioned. However, one study felt this wasn't maintained in the longer term. Also integrating with larger non-active travel oriented projects such as regeneration of roads, or the area as well. So this maybe didn't cost as many funds and there was less opposition to it. And also there was this idea about actually just needing the right time and the right person as well to be able to proceed and bring change. So the policy and political environment was also very important. So I'm going to speak about then policy first. So some studies felt that they were able to use the likes of their local plans and policy documents to hold the likes of developers to account. However, many people actually felt that the ones that they had, it really didn't have much power and many people didn't pay attention to it. So there was an awful lot of call for trying to embed this in higher legislation and so that people actually have to adhere to it as well. As well, if there was any updates or new transportation plans, this also gave an opportunity for new people to be involved and to give their input in the likes of consultations. And also as well, they may also raise the opportunity to act upon them also. So political will, it was quite complex because obviously you want to have the support, so it has to be navigated. So preempting, some people said about who actually would support it and trying to pick the battles. However, this maybe may end up in having more disconnected sort of cycling routes as well. Gaining money from external sources or higher levels of the government. So it was felt maybe if people were giving funding, the politicians didn't feel like they could refuse it, especially it was going to be good for the community as well, and it took it out of the political realm. It's more likely to be acceptable to politicians and decision makers if vehicles were not deprioritized. And also as well, there was one study in Denmark and it said about how there was a politician who really pushed ahead in making change, and this has actually had a long-term influence and trickled through all of the party priorities in the future. And there's a need for a long-term vision extending beyond the current party term. Some very brief discussions, conclusions. So overall, you need to identify the right people and collaborate with them, know your audience and tailor your messages, have active travel embedded in legislation. And all of these themes were interconnected and reliant on each other, so should all be addressed. However, need to be aware as well that there is different context and there's also different constraints that people need to work within whenever trying to apply these findings. So some areas for future research as well that were necessary was, so there was only one that was on rural area, only one that was on a new development as well. Only 5 studies spoke about trying to design for underrepresented groups, such as people with disabilities. There was none that was on writing guidance or commissioning. There was only 4 that actually did any sort of contrast between contexts, and there was only 3 that looked at walking infrastructure, and there's many more, but that's all I'll say for now. So just some next steps with what we are currently doing, some field work. So this is also as well to do with policy processes, however, it's on active school travel. So as Jenna mentioned as well, so it was doing this comparison between Darlington and Northstowe. So the aim of the study was to explore the development and implementation of environmental interventions and policies to promote active school travel from a policy perspective. And we were interested in looking at how the national guidance and policies interpreted and implemented on a local level and the influence of the contextual factors. So at the minute, we are doing this field work, me and staff are recruiting people and doing the interviews as well remotely. And we're also going to be doing some document analysis. So hopefully at some time soon, we'll be able to report back to you on our findings. And that was all. I just want to say thank you very much. And thank you to everyone who's been involved in this as well. Thank you.
Emma, we have a little bit of time for questions. So the findings that Emma's presented, more than welcome to pop those into the chat. Maybe I will just ask a question while people are thinking of other questions, or maybe typing a question into the chat. I guess it was one actually. I wondered if there was anything, Emma, that you thought was surprising or kind of unexpected from the review.
There was some bits and pieces, like I kind of thought that collaboration was going to come through an awful lot, and the likes of funding and things, like there was some kind of more obvious sort of ones. There was some more of the sort of detailed bits about how people have been able to change policy by just trying to strive ahead and try and make change as well. I thought that was quite interesting. Also about how everybody has a role also, because also it was maybe even community representatives as well, and also about bringing people together. Also, I hadn't really considered about how there was maybe different advocacy groups also, and how joining them forces and working towards these mutual aims also could be helpful.
So advocacy groups working together rather than...
Yeah, so ones that maybe are, like I said, about ones that are more focusing on leisure cycling, how bringing those people, and also walking groups, they all have the same mutual aims, so bringing them together, how they could achieve change. I hadn't really considered the likes of that before as well. So there was a few things throughout. Some of them I haven't been able to go into much detail on as well in this brief summary. So some of the nuances and some contextual features as well.
Emma, would you like to pop some of the questions that you had into the chat, or ask those questions like Steph did?
Yeah, I was just kind of wondering if anyone thought if there was anything that was applicable to the UK context that would be able to take it forward, whether in policy or rang true for people as well.
I guess with the majority of our audience, academics, there might be less kind of policy folk able to answer or contribute to that. Although there might be people reflecting on their own experience or their own involvement, actually. So Matt's popped a question there. You said a bit about whether research evidence may be useful for influencing this. Of course, there are other types of evidence besides research. So I wondered if you found that other kinds of evidence, not just research, were influencing decisions.
Other kinds of evidence. So I suppose, like I mentioned about the public support as well. So it wasn't always technically quite research evidence. It was just kind of knowing what the general opinions were in the community, whether it was from the media, people's complaints, or maybe there had been sometimes polls as well, and charities had done also. So there would have been that, also as well if there been very positive portrayal in the media of them. I'm trying to think if there would be anything else really beyond.
I guess sort of cost benefit analysis. Some of that wasn't kind of evidence, but more sort of that came from the local authorities or local practice.
Yeah, because there was one thing as well which I thought would come through more, was about the safety. However, some studies actually said that because there was only a small number of accidents, it was quite hard to actually have any sort of statistical significance for it and to be able to prove that as well. So safety didn't actually come through as much as an argument for the infrastructure also.
So Matt Val says, in which case do researchers have a role in trying to influence or at least convey that other kinds of evidence might be useful, I'm guessing?
Yeah, I would say so. From the studies also, it seems that there wasn't maybe, like some people found it from the likes of Google, online searches, kind of just word of mouth and things like that as well. So there's multiple sources where decision makers actually got their evidence from. So I think maybe, yeah, we should also try to use, as you say, about the media and public views as well. So I think that would be a start that we could do. Can you share a little more about what types and how the context influence policy and decisions? Context influence the policy decisions. So context, I originally had found a lot for. So there was about the sort of people that were living in the area as well, trying to their needs. Also as well, if there had been previous investment also in the area. Also, if there had been any sort of geographical barriers or anything, considerations such as that. Also as well, even in different countries, the likes of the structure of governments or how people access decision makers as well, it varied quite a lot. Also as well, yeah, hopefully that answers it. I'm trying to think.
I guess the other thing to say, Emma, was that there wasn't enough information about context to really go into the detail of what might have brought out a successful context. So it was quite hard to make any formal comparisons across contexts.
Yeah, so there was only 4 studies that actually compared different countries as well. So it was quite hard to unpick some of those sort of contextual factors and what actually had any sort of influence as well. So that would be something that should be done more in the future also, I'd say.